So many don't realize it, but we actually have a world-class brain and spine center right at UConn Health.
Yep, and Irene and I had the chance to speak to two of the doctors there. Take a look. Do you suffer from neck or back pain? Are you not sure if you should see an orthopedic surgeon or a neurosurgeon?
Well, now you don't have to choose with the Comprehensive Spine Center at UConn Health. And joining us now to talk about it are Dr. Isaac Moss and Dr. Hilary Onyiuke, the co-directors of the center. Thank you both so much for being with us today.
Thanks for having us.
Now, you cover a patient's care through every step of their journey. Can you tell us a little bit about the centers if anybody out there doesn't know about it?
Sure. So, we have what we call there's a comprehensive spine center. So the comprehensive spine center means that we really attack any problem that may occur in the spine from all directions, okay? And which means that whether you need physical therapy, whether you need an injection, whether you just need someone to sort of evaluate your imaging or whatever's going on with you clinically to give you some advice, we cover that whole spectrum from the non-operative all the way to the operative. And if you do get to the operative, which is always a last resort, we have both orthopedic surgeons who are specialized in spine and neurosurgeons as well. And sometimes we do things independently, sometimes we do things collaboratively. And so we feel that way we're really able to give patients access to whatever care they may need.
And so just as you were mentioning, it's so important to have both of those things under one roof, because is it the case where people come in and they don't know who exactly they should see?
Yeah, I think in modern day medicine has gotten very complicated, right? Meaning there's more and more specialization as we go. And spine surgery has sort of become a field of its own. And that is, and because it involves both nerves and bone, it's something that has really crossed over between neurosurgery and orthopedics. Now, Dr. Onyiuke, who's and myself have been working together for 10 years, so this isn't really a new concept. But what we're trying to do is formalize it so that patients really can make a single phone call and will get the care they need regardless.
And how important is it to have Jackson Laboratories on site as well within the center?
So that's actually very good for oncology. If we're talking about surgical oncology to the spine, because that's really because it's a genomic laboratory. So they will do gene typing. So if you actually do have tumors of the spine, whether it is benign or malignant, then they're able to sequence you and actually have some form of personalized medicine or personalized care. So that is really a huge thing that we have in collaboration with Jackson, not only for spinal tumors, but also for cranial tumors.
And so what is your advice for someone suffering from neck or back pain? I mean, it's got to be an incredibly common thing, but what should people look out for and what should they do?
85%
do you want to go ahead with that, Isaac, or do you want me to go?
Sorry, it's the difficulty in the Zoom. 85% of people will have back pain at some point in their life. So it's, like you said, it's extremely, extremely common. Fortunately, most of it is self-limited. So working with, even just some time, some anti-inflammatories, that usually will resolve a lot of it. When that doesn't work, you can often look at things like physical therapy, which again, we have providers here, but there's certainly lots of great physical therapy throughout our state. And it's sort of a continuum of care where we always want to start with very simple things, because for the majority of people, of that 85%, very few will ever need surgical intervention. So again, that's why having a center where we have all these services available will help that patient make sure they're not getting overtreated, they're not getting undertreated, sort of that Goldilocks perfection of where they need to be.
I think it's important also, not only are you treating the patients, but you're giving support services to the families that come in too, so that they can all help to make an educated decision.
That is true. So again, just like Dr. Moss said, the primary treatment really still goes to the primary care physician. They really coordinate most of this, which is why, as Dr. Moss said, 85% really don't require to see a specialist. It is only when, so most of our practice, him and I, is really based on referral. But however, those referrals are based on surgical care. So we need to really emphasize that it's really the family doctor that really, by and large, actually manage a lot of these patients. It's only when it really goes beyond the non-operative care, that's when they actually refer to the spine center. And as Dr. Moss said, it's not only surgeons you have there, you also have the physiatrists who are the ones who do the non-operative care, the physical therapists and all that. And then eventually it may escalate to the surgeons, but the point is that you don't have to go to more than one location. Everything is in one physical building, one-stop shop.
Which is a great benefit to everybody. A lot of people might not realize that the brain and spine are interconnected. When they have back pain, they might not realize. It's like, well, why are these two disciplines under one roof? Well, they're connected, right?
Right. So, and that's one of our new initiatives is, again, the Comprehensive Spine Center has sort of been an entity for a long time. But what we've noticed, again, is the more collaboration we have, the better it is for our patients. And so what we've designed is what we call the Brain and Spine Institute, because it is a continuum, right? The spine contains the spinal cord. Well, that's just the conduit from the brain to the rest of your body. So we felt that with the providers that we have, if we can really bring in everybody that touches this space. So that means now not just surgeons, not just physiatrists, not just physical therapists, but we now have neurologists who are involved in the patient's care. We have special radiologists who have done training to look at the brain and the spine. And in this way, again, the more collaboration, the easier it is for patients, because they don't need to decide, do I need to see a neurologist right now? Do I need to see a spine surgeon? Because who knows, right? You have a problem and you want to get the care you need. And we've learned over the years that the more collaborative we have, the more we can sort of build these centers that instead of being siloed, oh, the brain is one thing, the spine is one, the idea is patients are patients, and we want to be able to sort of treat them comprehensively, literally, in this case, from the head to toe.
Well, you've given us a wealth of information. We want to thank both of you, Dr. O, Dr. Moss. Nice to see the both of you, and continued success.